I've been doing health privacy for like 30 years more. So I have a broad perspective, a historical perspective at least, from a policy, at the policy level. I don't actually have anything to do with real health records or systems. And life has changed over that time. Essentially, when I started doing this in the 70s and in the 80s, everybody paid lip service to health privacy and no one did anything. There was no training, there were no privacy policies, no one really knew what the law was. In a lot of areas, literally the lawyers for hospitals did not know what the laws in their states were and no one was paying attention to it. There was a major effort at various times. I was at the center of it when I was on the Hill. First time was 79 and 80, and then again as part of Hillary's health reform in 93 and 94, and none of those efforts was successful for a variety of reasons that I could talk about well beyond your level of interest. And the issue sat, and eventually as the actual HIPAA, the law, HIPAA, Health Insurance Portability and Accountability Act, and the HIPAA rule, came about because Congress began to pass legislation leading toward administrative simplification, what it was called in the beginning, and then electronic health records, and there was some recognition that the privacy issue had to be addressed. And really, when the HIPAA law passed in '96, there was one senator who said, I'm not letting this law pass unless you address privacy, and so they put in a provision that said, if Congress can't pass a law in 3 years, HHS must write rules, and that's what happened. They couldn't reach agreement. They couldn't reach agreement in '96 when they were actually trying to write rules. And part of that bill, and that's sort of been the history of inability of Congress to deal with this issue for a whole variety of reasons, good, bad, and otherwise. And we ended up with the health privacy rule, and from what I can see, we've been dealing with what I call the usual transition from an area where there is no privacy rule, no privacy law, to one where there is. And it takes years for people to get used to it. And what we're seeing now is a generation of people who are getting into the healthcare system who didn't know what it was like before there were rules. So that seems sort of normal to them. And the old guard, which is still most of the healthcare providers and everybody else, have either gotten used to it, made peace with it, or they're grumbling about it a lot, but moving along anyway. So I think that there's been a lot of improvement in this area from where we started out, and I think that that's not to say that the rules are great, it's not to say that the rules are perfect, and if you have 2 weeks, I'll go through the rules section by section and tell you everything that's the matter with them. But it's good that we have a rule, and we have some kind of a baseline, and it's going to get worse from here, because the effort that's underway, led by HHS and directed by various pieces of legislation to have electronic health records, means that we have to confront the issue all over again, because essentially the model, if you will, roughly, for the health privacy rule was paper records. That's not true for the security rule by any means. The security rule came along with it. But in any kind of an electronic healthcare environment, with network records, and we don't know what any of this is going to look like yet. And whether the effort underway to actually do this is going to succeed remains to be seen. But there are challenges everywhere in this kind of system. My wife is going through training right now for electronic health records and comes home every day and bitches like mad about what they're making her do and how she can't do this and can't do that, and patient care is going to be undermined by all of this. And whether all of that is true or not remains to be seen, but there are clearly problems, and there are going to be a lot of compromises in the privacy area. I'm going to give you just one simple example. If you're seeing a podiatrist, maybe you don't want the podiatrist to know that you're also seeing a psychiatrist. That seems like a perfectly reasonable request, and if you start to figure out how to do that in some kind of, today or in the past, you simply just don't tell anybody. You don't tell either party what's going on. And it's not a problem because they're not likely to share records. When records are shared, this may become apparent to people. And when you start breaking down this problem in other circumstances, it gets really complicated to figure out how it is you can take records from one environment, one kind of treatment, and keep them from going to other providers or payers or many of the million other participants who will have access to this system. It's really hard to do. There are lots of trade-offs. It's not an area in which you can say, well, let's just have all the privacy that patients want and build that into the system, because it's probably not possible. So figuring out how to do all of that is the current challenge. There's going to be a price to be paid on the part of everybody in order to get some kind of reasonable operating system and provide some reasonable, achievable level of privacy for patients.